If you're trained on the health data from the UK, how could you apply this to people in North America, to Canada?
How we're integrating AI into kind of high stakes environments.
And I want them to use a CDSS.
Would we ever come to a point where we would trust an AI with the final result?
Hey, what's going on, everybody? It's Monday, October 7th, 2024, and you are listening and watching the Daily AI Show live. Today, we're diving into a topic that's both exciting and a little unsettling. The study is AI outperforming doctors in diagnostic reasoning, but the broader conversation is what happens when AI is just more right than we are. And so it was a fairly small study. It was an ex post made by Ethan Malik, and the community wrote a bunch of community notes about how he was implying that they were better at diagnosis, and it was a diagnostic reasoning study. And there are all of these things like the doctors weren't given training on using AI. So some of the things of them not using AI shouldn't be considered like a finding from the study. But here's the real kicker. How hard are we working to try to make it to try to attach ourselves to the fact that no, the human plus AI will be better than the AI itself. And in fact, the people who, one of the authors of the study was also commenting in that thread about, this was a surprising thing. We totally assumed, right? Our hypothesis was human plus AI is better than either human or AI alone. So this raises the, questions about how we're integrating AI into kind of high stakes environments, and what is the trust that we're going to have? Because it's not just about healthcare; it's a microcosm of a larger trend we're seeing across all fields of knowledge work. Right? AI is starting to become good at reasoning, right? Those are the O1 models from OpenAI, but also it's becoming steadily more capable, more accurate, and yes, sometimes more right than human experts in many areas. So that's what we're gonna talk about today. We'll look at the study a little bit, but then we'll open it up to the larger conversation of like, okay, so what happens? What happens when the future is now, right? These are things we talked about. Well, maybe we'll get to there, and we're not sure what we're going to do. The future is now. So, Andy, what are your thoughts about this? How have you taken this?
Well, it's been around a long time that the large language models are capable of passing clinical reasoning exams just like medical students. And so it's really just a matter of finding the right way to introduce that capability into the healthcare provisioning setting. And obviously that's not going to happen that we're going to suddenly have a standalone diagnostician, which is AI, that is competing with the humans who are doing the diagnostic reasoning and prescription, right? So I think what's really important to understand is that putting humans and AI together solves one of the largest problems, which is the large amount of data that's now available about any particular individual in the EHR context, electronic health records. So there are two really major companies out there, Epic and Cerner, which is owned by Oracle, that provide these electronic health record systems to the major hospital networks, and those EHRs can be shared across those networks. So when somebody presents at an ER, for example, the ER doctor is completely consumed by having to do the triage and the assessment of the patient right at that moment. But in the background, it ought to be true that the entire network of EHRs about that individual are being consulted by an AI and digested rapidly, which would take hours for a human to do. And so there's this acceleration of the ability to collect necessary information for an accurate diagnosis that otherwise wouldn't be available to the human diagnostic. So I think that there's going to be a period of time when it's always human plus AI. But I really like the idea of clinical decision support system, which is the term of art that's being used in the healthcare world, that could be allowed to run on its own and come up with a ranked series of proposed diagnoses. And let's take it away from the emergency context and instead just say, I present in a doctor's office and I want them to use a CDSS to augment their ability to avoid their own human biases and maybe their distractions and inattentions to what I'm saying. So that if there's an automated CDSS that's coming up simultaneously with an overall result, with a conclusion, a diagnosis, and prescriptions. And by the way, there's a huge, I want to take a tangent here about prescription, which, there's prescription on treatment. And in many cases, that treatment is pharmacological. And the number and breadth of pharmacological opportunities, shall we say, for application in the prescription is beyond the ken of any human person. Like they could probably keep in mind 3 different potential drugs that can apply to this thing, but there's 1,000 of them out there, and all of them are subject to intense data analysis around their clinical trials and so on. And so an AI can really help with the application of decision analysis around pharmacology. It can also, by the way, simultaneously say, oh, this person who's presenting to you at the Cleveland Clinic, let's say, matches the requirements for a clinical trial of a research drug that you don't even know about yet. And wouldn't that be nice, right? So I'm very hopeful about the integration of AI into these settings, but we're far away from the time when there's going to be the AI robotic interview with the patient. There's always going to be human in that process. And by the way, one of the systems that I came across in looking at this is supporting nurses and this is with the Mayo Clinic, by the way. They have a specialized CDSS, again, a clinical diagnosis support system or decision support system for nurses to help them conduct more precise and detailed screening of patients, ensuring that no critical information is missed during patient assessments. Because you can imagine the questions that are asked and the things that are said, you want to make sure that those things are comprehensive around the probable diagnoses, and these decision support systems can help the humans go through that process.
That's awesome. Thank you. Yeah, Jyunmi, what is your take on this?
I think I'm fairly aligned with Andy on this. I like the ability as a tool for medical professionals to enhance their processes. I think that's the number one way we're going to integrate AI into the medical field. Having that key point of remembering all the thousands of different options, right? That alone, I think, is worth it, where you have this resource with extremely accurate information, tons of data and research capabilities, so that you can just access that resource and use that as part of your overall diagnosis, right? And your overall treatment plan and things like that. Ultimately, personally, I want to make sure there is a doctor that's making the final decision. And I think a lot of that comes from having a certain level of accountability and responsibility, and just having that extra point of human connection, which is, for me, is a high priority. But the possibilities in terms of having an additional resource and a tool that can help you access all those resources and enhance your own capabilities, that's the part that I find most exciting. In terms of, these percentages and numbers that are thrown out, yes, there's a lot of back and forth and clarifying and things like that. But I think for today's show, really thinking about, I guess the question for me is, would we ever come to a point where we would trust an AI with the final result, with the final diagnoses? And I'm on the side of, no, I don't think we would completely trust an AI for the final diagnoses. I think there might be a certain level where we get the accuracy and the capabilities to a point where the doctor finally goes, yep, that's 90% of what I need. Let me just verify. Okay, cool. Yes, I agree with this. And that cuts down on, the time till healthcare, right? Or the time to healthcare kind of timeline. So lots of room here, I think. Lots of different applications and points of entry. But ultimately, I want a human to tell me what the final result is. And that could just be because, I'm old already. So, maybe 20 years from now or 40 years from now, that won't be an issue anymore. Yeah.
So I came in feeling like you, but Andy's point of like, hey, I want a doctor who is going to like I want you to show me how much of the current information you have consulted with. And I hope it isn't that you read 5 studies over lunch yesterday, right? Like or at least I hope like you consulted with something that like condensed the studies to the 5 that you really need to read, because, right? Like I agree, Andy, like there's more that like AI is kind of perfect at being able to digest and analyze a ton of information. And I also want to say welcome, Karl. Yay. The other piece for me is I'm curious about that, about the nursing augmentation, right, happening at the Mayo, because I know that there's a doctor that I fill out, right, and I'm doing like between 1 and 10. How do you feel about this? Right? So you get a bunch of numbers from me, and over time you can see that like I went from a 3 to a 5, right? But there's no additional, like, what does that mean for you? This is just like, it's just like, okay. And also we know my 3 is different than your 3, right? I mean, there's that kind of stuff where you're getting like quantitative data that is maybe not a ton better than qualitative kind of information. But Karl, what's your thought about this? This was actually, this show came from a suggestion from you talking about like, okay, so what happens when we're in a position where the AI is more right than the human?
It got me thinking. The reason why I posted this, I got a couple of friends who are doctors. My sister-in-law's a doctor, a friend of mine's a doctor, another friend of mine's a doctor. So a couple of them, I was thinking like, I was talking to them about, hey, you should be using AI more. And one of them was like, no, because, like my patients are my patients and I'd rather do it this way and I don't think it's ready yet. The other one was like, I don't know what you're talking about, so I'm just going to do what I do. And then the other one was like, man, I'm too lazy for this stuff. And then that was kind of it. So, but what really got me thinking, because I met a client, not in the medical field, and just thinking about the amount of data that a person has in their lifetime, health data, plus all the data that's out there on recent studies, previous studies, all that kind of stuff related to whatever both ailments that they have today, could have 5 years from now, and how to prevent anything else. So there's a bunch of them. And I was actually talking to this one group who that's their specialty is preventing whatever it is, like in the next 5 to 10 years, and looking at that diagnostics. And I think they had a proprietary system out of Israel using AI to do those testings and to run those diagnostics and providing that feedback to the client to showcase based. Now, the only problem with their issue is their study is most of their data is from the UK. So it's like, well, that's UK people. How would that translate? If you're trained on health data from the UK, how could you apply this to people in North America, to Canada, locally to, Alberta in that geographic area? So that was one thing. But that's what got me thinking is the amount of data to process that. Now, for a diagnosis, also knowing that the doctor if you look at what the doctor does in a day and looks, when you go into a clinic checkup, whatever issue you have, that doctor only has 15, 30 minutes with you for initial assessment. And if they don't, or they're not sure, or they want you to go see a specialist, so that's another thing you have to book. And then the specialist may find whatever you need and then recommends a treatment for that, or prevention or whatnot. So I was thinking, imagine if those two, the specialist and your general clinician, general practitioner, were to have this AI kind of advisor, or both of them have access to your historical health data that they can pull from and make their diagnosis a little bit more accurate, 30% more accurate, 40%. I'm always talking about the 10 to 40%. Could it be 10 to 40% more accurate? And then maybe that's the baseline. And then from there, move up. It's not to replace the doctor, but imagine that doctor has that data available to them in a very easy conversational manner, right? So now with real-time API, you can have that conversation, and the patient has access to their own data in conversation, much more easier, right? And then all the analysis and whatnot. So I think that to me is when you say enhance a healthcare, not replace anybody. I think that's just the amount of data that we have, but then the ability to relay that back to the patient in a way that they can understand, and then just give the health industry and health professionals itself. Because it isn't just doctors. Every single time you go to chiropractor, or whatever person in the medical field, they always ask you a whole bunch of questions because they need to know. But imagine if they had access to that right away, and then it'd be a little bit more personalized to you.
I like this idea of involving the patient before the consultation. And I'll use an example. Like typically today, when you go into a doctor's office, you're likely to not be seen right on time. Why? Because they're behind, they're pressed, they have lots of people, on their schedule. And you have to fill out sometimes, if you're a new patient, you have to fill out a long questionnaire where you're basically checking off a bunch of boxes. What do you think the probability is that doctor who's seeing you has actually reviewed that carefully before they come in to meet with you? I mean, they might have 20 seconds before they come in to the room to actually look at something that you prepared there. Now, imagine in the future instead that the patient portal that's a part of the Epic and or Cerner system, or McKesson, the big EHR providers, but who also provide the systems that keep those records electronically and provide access to the patient. Because, it's been a long time since I've had to go back to a doctor to see the results of tests that were performed on me. Those get popped into my patient portal and I can read them. Now, there's also 4.0, and I can have a conversation with the clinical reasoning AI about my conditions and spend a good bit of time myself in dialogue with a pretty good diagnostician. And so I, like many patients, are coming into the consult with a doctor with a lot more information than used to be. And doctors originally, I think, resisted this because it was poor information gotten from Google, like very superficially, and maybe even from social media. Hey, I saw this TikTok that said that I might have this. Well, they hate that. And instead, they want to do it in a more scientific way. Well, AI now, and particularly, 4.0 and maybe some of the others, I haven't played with those, can actually have a clinical session with you before you come, and you might add that to your patient portal, or eventually imagine the patient portal. That's where I have that AI-driven dialogue. And all of that information gets comprehended by the AI decision support system, because now a good part of the person-to-person conversation doesn't even have to take place, because the AI has digested and summarized that for the doctor before you come in to the room. And all of that just is a lot better than what you've had before. So I'm excited about the possibilities, but it's a very complex process to implement. But I hope that eventually patient portals will have AI built into them, so that the AI can look at all of the history and have a conversation with you. And I have an example. I did a quick little example on ChatGPT 4.0, but I'll do that later, of a medical inquiry I did about my own knee condition. So it was pretty satisfying.
Very cool. Karl, did you have something you wanted to say?
I thought Andy had, like, when he was saying he had an example, I was like, I was going to show this example.
No, please don't.
The challenge I think we have with this is the healthcare industry is very, very difficult to add new tech into, and the amount of pushback you'll get, maybe not from the practitioners, but from administration in different, whether it's hospitals, health region authorities, state or provincial boards, or things like that, to just because I also feel there's two parts of this. One is the amount of bureaucracy needed to approve and ensure safety and the liability of that. And then two, I believe there's money, whether to be made or to be lost, that's also going to impact that. And I don't know enough about that industry to see how this can be integrated in, and what companies would want to enter that field to supply that technology. We've started to see a lot of the research done, like by Google, some companies partnering with companies like Google and OpenAI, but I haven't seen anything from the health boards to apply, like, to do that. So I don't know if it's sort of like some doctors will secretly have these things, and then it'll just become so prevalent that everything, like, they'll have to apply it. Or I think that's the one thing I'm not sure of, because health is its own bureaucratic, nearly its own economy too, with different applications to it. I think, like, we all, we've gone to hospitals and we've gone to our doctors, and it's like its own ecosystem. So who knows how that thing's going to be put in there.
And Gwen has an interesting thing, because I think the same thing. So 3 of us are Americans, live in the U.S., and Karl is Canadian. So 3 of us have the U.S. healthcare system, and Karl has the Canadian Universal Healthcare System. Is it easier in Canada? Like, does Canada do you fight with insurance companies or do you fight with the government insurance company?
Not really, but it takes longer, right? Because yes, you do have universal healthcare, so you're covered for a lot. But let's say, for example, there's always the question about two-tier healthcare or private healthcare, and there's always fight in between. And it's about, let's say, so for example, my brother has microfractures in both his shoulders, playing football a lot, so he needs to get shoulder surgery. The question is it essential, life-threatening, and like what are those levels of things that you need to get done? Because if on their chart or on their scale, if it's not, then you might have to wait longer. But there are opportunities for you to pay to get it done faster, right? So it really depends. Now, something like this, I'm not sure if it's quote unquote easier, because I don't think this would not, maybe it falls under insurance, I'm not sure. But just like any North American style healthcare, it's the administration side, not the people get access to it. The company that I was talking to about health prevention, that's like, it's going to cost like $15,000 a year. So there's only a select few people that can access that, or like not select few, but those are willing to pay 15 grand a year to have that type of monitoring for their health. So, in quote unquote, it's like healthcare for the rich. So that probably won't be covered under universal healthcare. But if you think about it, shouldn't it be? Because if you are now can detect and prevent in the next 5 to 10 years, wouldn't you say the government would be wanting to be part of that because it can reduce the stress on your healthcare system in the next 5 to 10 years? So that would make sense. But then to get that approved and all that fun stuff is, you're going to have the debate. How are you going to treat patients today who need it now, or those who are looking to prevent 5 to 10 years in the future? I would say both. I just don't know how to apply it. And it would then there would have to be some public push or some very, very courageous lawmakers to push that kind of thing through. And that's like, usually those things aren't priority in a political agenda. Maybe it is, and maybe it's some private members bill that's just like, oh yeah, that sounds like a good idea. Let's, approve that. Maybe it works, maybe it does. I don't know, but yeah, that's probably a bigger question than in the space itself.
Yeah, and there's definitely been in the last few decades, from my touch points in the healthcare system, is preventive maintenance or preventive medicine is they've seen the numbers work out over the last few decades, and it's a huge factor in all healthcare. Is if you can take the time and effort to do the preventive medicine, then it will save you so much on the back end. All right. So if we're just looking at numbers, then if you've been looking at what kind of healthcare offers and things like that, and what kind of programs HMOs are pushing forward, at least in the US, preventive medicine is a big one, because they pay less if you just don't get sick. It did take, because of the input from family members in the field, I've heard lots and lots of conversations of, we told you this 50 years ago. Why did that kind of conversation? But essentially, I would love to see preventive medicine integrate with AI. And what we've talked about here so far is a lot of being able to ingest a lot of information, make those initial, diagnostic reasoning, make those initial suggestions, here's all this information that you're supposed to have already, healthcare professional, those kinds of things. And I think that's a perfect slot to put it in there, because it's more about, let's discuss your overall health. Let's discuss your health plan and just prevent you from being sick or hurt, or minimizing it as much as possible. Now, on the emergency side of things, I'm not exactly sure yet. I don't think we've seen a huge amount of AI in that space yet, but that'll be an interesting sector to take a look at.
Andy, do you want to share your research? I'm super interested in that. Thanks.
Yeah.
Jyunmi.
So tell me when you see my screen. I think you do. So this is ChatGPT 4.0, not even 0.1. So we're not going to stress the reasoning and sort of interactive pursuit of anything where the AI is asking me questions. But I'm going to just fast forward to say, I think you'll find that what I found in response from ChatGPT 4.0 was pretty satisfying and validating about one of the possibilities. And of course, they have all the caveats about, you really should see an orthopedic surgeon and get an MRI. But here's what I presented to the diagnostician here. I've been having persistent pain in my left knee when it's in a bent position and unweighted. For example, pain is immediately triggered when I stand on the right leg and lift the left knee into a bent position. The weight of the lower leg and foot is all that's being carried by the knee at that time. When standing on the knee with only light flexion, no pain, and I'm able to walk without pain so long as I don't flex the knee much. I cannot bend the knee past 90 degrees without much pain and stiffness pushing back on that trial. I have had a meniscectomy on this knee 2 years ago. Okay, sounds like you're dealing with knee pain that may be related to the previous meniscectomy, possibly from lingering issues with the knee structure, such as scar tissue, cartilage, and other soft tissues that could be causing pain when the knee is bent without load. Since bending the knee beyond 90 degrees leads to stiffness and pain, it could indicate mechanical restrictions or inflammation. And it says, here's some possibilities: scar tissue, cartilage damage, pedalofemoral pain syndrome, and synovitis. So I can kind of drill in. I could ask follow-up questions about those particular ones. And perhaps with 0.1, I could have said, okay, now I want you to ask me all the necessary questions that you need to pursue a diagnosis of which one of these possibilities is true. And here down here it says best to consult with an orthopedic surgeon or orthopedic specialist who may recommend imaging to really finally resolve that. So I thought that was really satisfying, and it really kind of, it made me say, okay, well, within there, by the way, one of the recommendations was, hey, go to a physical therapist and they can maybe help with, that. Because I had a follow-up question here was, I pointed out that I thought this was associated with me spraining my right ankle and maybe gait changes that happened as a result of my having to favor, that right ankle. And that might have made some changes that caused changes in my knee as a result of changes the way I was walking. And so it had a nice conversation you see here about how that proceeds. So before you go to a doctor again, I hardly recommend that you engage in such a dialogue with this kind of AI and see if you can come into the dialogue with your doctor with much more information. And don't drive the conversation, but just be well prepared as you go into that discussion. And you'll be able to evaluate your own doctor about, how effective are they in such a conversational examination of you with all of the knowledge that you have about your own internal perceptions of the symptoms.
I'd love to see a comparison of, because I saw in chat, people were mentioning like WebMD. That's like the notorious website. So I'd love to see a comparison between your output from AI to WebMD, then taking it to the doctor and going, okay, which one's better? Which one would you rather I inform myself with?
Well, I'm going to say that the AI, in this case 4.0, would have all the information from WebMD somehow in its understanding. So what you might get from WebMD on asking questions about knee cartilage or, pain and so on would be just the basic, pages that are on WebMD about that condition, not the specific symptoms that you heard me present, which is a little different, right? This is not my knee hurting when I'm walking. That's not it. It's a very different kind of pain that makes it really hard. Like when you're sitting in your car and you have to lift your knee to turn and get out, that's painful for me. Why?
Right. And that, I think that really leads to something that I find really interesting about this. Again, we're talking about large language models. They are language and pattern recognition machines. And medicine, and specifically the interaction between patient and doctor, is a pattern, right? There is a pattern that the diagnostician is looking for, and I don't know what that is because I am not a diagnostician, right? Like, I don't have that. So the ability to have a conversation and say, all right, this is the way that I put it in my language. How would I communicate this effectively to my doctor? Right? Because that's helpful. We do it with business speak all the time, right? Like, okay, this is what I say is screwed up in the Salesforce org. Let's write that up so that makes sense to everybody else. So like that kind of thing I think could be really interesting. Andy, the other thing that I wanted was I want an option to have a conversation with the AI in the doctor's office before I leave, because I may have other questions, right? Like, let's have the conversation. Then you go and see the person in the next room, and I may leave, wave at you, no problem. But I also may sit here because now I have another question because I am also using my communication tool to understand what we just talked about.
And imagine now that you've got tools like O1 and the advanced voice mode, you could have your phone participating in the discussion. And your instruction to the AI would be, don't say anything at this point unless I asked you to specifically. So you're just listening, but I want you to collect all the necessary information in the conversation I'm having with the doctor so that we can discuss it afterward. That's going to be cool.
Right. And this happens in the sales conversations. Karl, you may have more information about this too, right? That we go back and say, okay, so what was missed in this conversation? And the AI says, so you didn't emphasize it and the doctor didn't acknowledge it, but there's this piece that is also happening for you. And that might change the rest of the conversation. Or, right, if that were held as valuable as everything else, the conversation might go this way. And therefore, send a message to your doctor through the thing and continue this conversation. Like, I find that really exciting. And I know that happens in like sales call analysis, Karl, right? Like, so there's when we analyze the thing, this is what this was missed. The client or the customer wants, blah, blah, blah.
I think what's missing from both is the contextual piece. So whether you put it through an automation, whether you put it through something like Claude or ChatGPT, you still have to put the context into it. But the amazing part of what we're thinking about is that's connected to your personal health history. So the context is already there. Think of it like a RAG system that's always being fed every single time you have some sort of prescription, anything touching whatever has anything to do with your health, maybe even your workout schedule. I don't know. But I'm sure something like Apple Health, there's somebody there thinking about this. Like, okay, you have this person's watches strapped onto me all the time, getting all the vitals from this person. So it's somewhere. Like the data somewhere. Now, can you connect all of that and then have an AI filter through plus the conversation? Imagine from a business perspective, if you had that person's, I think that's the hard part because no one keeps track of like what people, like, what did I buy? from all these different places. I think that's a little bit different, but you need a little, but I think the healthcare one, everyone has some sort of like centralized health thing for themselves. So how can the AI tap into that from all the different sources your data has been pulled from, right? So I'm curious to see where that goes.
Yeah. So I'm just going to share my last final thought that's making me laugh. Are we now going to be segmented into AI context windows? Right? Like, no, I'm sorry. My health is like a Gemini 2 million token over here. Like, nope. And as you get older, maybe just because you have more data. All right. So thanks so much. We're going to wrap it here. Thanks so much to all the people in the chat. Gwen, Cisco, Jen, Justin, love to see you. Everyone who is also watching but hasn't chatted yet, awesome. Tomorrow we are talking about a little bit about OpenAI Dev Day. We're doing a little bit of a wrap up, but then we're really diving into Canvas, because ChatGPT Canvas is both changing the game. The question is it changing the game? I think the answer is yes, and also not as much as it might seem to be, but also it's a harbinger of things to come. Wednesday we're going to do news. Thursday we're talking about Perplexity API and its effect on custom GPTs. And Friday we'll be talking about business use cases for Notebook LM, because everyone is still talking about Notebook LM and they're using it in a bunch of different ways. So we hope you join us all week. We also have a newsletter. You can find us at thedailyAIshow.com. And that is a wrap for us. Thanks. Have a great day.